I'm an assistant professor at Baylor College of Medicine, and I'm affiliated with Texas Children's Hospital, where I serve as the co-director of the Sickle Cell and Thalassemia program in our Cancer and Hematology Center. I think of sickle cell disease as an ancient disease. It's been around for thousands of years, and for the United States, more like hundreds of years. But because of that, there is a lot of work that has been done on it, and yet there's so much more that needs to be done. So the most striking things in general about sickle cell disease is that magnitude of the burden, how great some of the disparities are. And this happens no matter where you live in the world with sickle cell disease. But then also the amount of innovation that has now, in the recent decade, fueled the space forward. And so I think a lot of people have been excited most recently about gene therapies. And so that's probably, if you do a Google search for sickle cell disease right now, that's probably one of the top things that will show up. The fact that we live in an age of gene therapies, and one of the diseases that gene therapies can support is sickle cell disease. There are several misconceptions and myths about sickle cell disease. And you mentioned which ones which are the ones that are giving clinical impact. And in a way, all of them do. Some of these misconceptions are more prominent in the general community, like individuals that have sickle cell disease or societies that have been impacted by sickle cell disease, and the general community that has limited awareness about sickle cell disease. But then some of these misconceptions are also embroiled in the medical community space as well. And so I would say I will name a few, and I will explain which ones are more community leaning versus medical leaning. But in general, I think a common misperception is that sickle cell disease only impacts people of African descent, Black people or African Americans, depending on where your context is. And that is a big myth. However, several people, especially in places like the United States of America, sometimes that's their framework for sickle cell disease, is that it only impacts one type of ethnicity or race. And then a bigger misconception that is linked to the larger view that it impacts only Blacks and minorities is a more dangerous one that comes from the side of medicine. People with sickle cell disease often struggle with pain. Pain is a common complication for the disease. And in the United States of America specifically, we treat severe pain with opioid medication. Now, even before the opioid epidemic, I think there have been concerns from the medical community at large about giving opioids to individuals with sickle cell disease, because what they interpreted as their pain condition was more seen by the medical professionals as an individual that is drug seeking, as if they are addicted to drugs or their main reason for coming to the hospital is to seek drugs and not care. That is probably one of the most harmful of the misconceptions for sickle cell disease, and leads to delays in care and even increased mortality. Because when you delay care, and also pain for sickle cell can sometimes be a warning sign of something worse. Those are all things that keep the person from getting attention and can lead to them dying prematurely or having worsening of their disease, all which are terrible. So those are the two that I want to start with. This emphasis on it kind of addressing only one population, which is not true. And then the concerns that people with sickle cell disease are drug seekers or not worthy, if you will, of getting appropriate pain management for severe pain. The nuances behind this actually steep back to historical roots, where doctors had misconceptions about individuals with Black skin, thinking that their skin is tougher or that they don't feel pain in the same way, like they have a higher pain tolerance. And this is even recently when you see articles written about medical trainees and other doctors asking them what they feel about various patient subtypes. You'll see these myths and perceptions being highlighted in their responses. And so all of that is wrapped into the space of sickle cell disease.